This time, who's got the attendance report?
I can do it for you.
Okay.
Okay. So is Scott Johnson on? Does not look like it. Wes Lewis?
I'm here. Can y'all hear me?
Yes,
Yes,
we
sir.
can, Wes. Good. Thank you.
Okay.
Right.
Doug Aldrich?
Here.
Monica Walters? Here. Dave Barbie?
Here.
Perfect. And it looks like we're missing right now Rochard, Lisa, Scott, and Jack. But with 5 members, we do have a quorum right now.
And Lisa's not here. Okay.
That's right.
Okay. All right. So we got the consistent or the amount of people we need in order to have an official meeting.
Yes, sir. And Scott just joined.
Oh, hey, Scott.
Hey, yeah, can you hear me?
Where are you now, Scott?
I'm in Riceboro, Georgia. Where, if you know where that is somewhere along.
You got your literacy tag on today,
Yeah.
so you're double playing.
That's right.
You're double roll.
That's
All
it.
right, we
Thanks,
appreciate
guys.
you being here with us.
Yes,
right.
sir. Good to join.
So I guess now we'll just start off with the program reports.
That's right.
Mary?
Thank you. Good afternoon, everyone. I am excited to share some updates, initiatives, and observances in child welfare. But I'm going to start today's presentation with a couple of data points that the board had requested. Next slide, please. So this is a look at the number of youth in foster care. And what you're seeing here is exits and entries into foster care by month from July 2022 all the way through August. So we've got a nice long look, and you can see that we have a good bit of movement each month in the number of children who enter care as well as exits from foster care. Next slide, please. So this is a look at the same time frame that gives you the overall foster care population. And you can see that we've had just a slight decrease from where we were 2 years ago at 10,775, and most recently at 10,382.
So the 632 is what on the last in August?
If you look at the next slide, that kind of lays that out. So 632 are young adults over the age of 18.
We won't have that. It's a 24-hour day. The entire year.
As of August 1st, we had 1,561 positions of folks who were working in frontline jobs for us. And their average tenure is 3 years with a median tenure of 1 year. And then we have 25% of those employees that have less than a year of experience, and 75% have less than 3 years experience. Before we move on into some additional data, I want to share with you, and this is on the next slide, a little bit more about our frontline positions. So those are commonly called case managers. The formal job title for that position is social services specialist. And this is the only place within child welfare that we do have a career ladder. So all new employees start off as a social services specialist one. The starting salary for that position is $47,000. And after 2 years of continuous employment with successful performance, staff are eligible to become a social services specialist two. That comes with a 10% salary increase. And then after 3 additional years of continuous service, so 5 total years of continuous service and successful performance, they are eligible to become social services specialist 3. And then our supervisors
Hold
are,
on, is there another, income increase?
yes, there is,
Another 10%?
another 10%,
All right,
yes.
thank you.
And our supervisors are identified as social services specialist supervisors is the formal job title for those. Next slide, please. So this breaks down each of those job titles and the number of employees and years of experience in each of them. So we have 925 employees who are the specialist one, and they have the least amount of service. Obviously, we have 390. Their average length of service is 3 years, and then 303 specialist 3 employees with an average of 12 years of experience. And then our supervisors average over 8 years of experience.
And how many supervisors, how many specialists, 1, 2, or 3, does each supervisor supervise?
We like to keep that around 4.
Okay.
Sometimes it's a little bit more than that,
All right.
but that's the place that we find is most effective, around 4 or 5,
Okay.
depending on the program and also depending on the experience of the
Sure.
supervisor.
Thank you.
Well, we have 925 1 year. Is there a huge drop off? I noticed the specialist 2, 390, then when you go to specialist 3, there's 303. Is there some type of attrition with this or what? I mean, is there a reason for the drop of them leaving?
Well, there is, and it's not necessarily all negative, right? So some of those folks may become promoted to other jobs in the agency or become supervisors before because you don't have to become a level 3 position, right, to promote to supervisor.
Oh, okay.
Okay, all right.
Next slide, please. So one of the things that I'd like to share with you all that we did for the first time ever in August, we held a permanency forum. And this was an opportunity for our child welfare leadership and special assistant attorney generals to get together to discuss permanency and ways that we can work together to increase permanency. We held this in Augusta, and the large group, so both sessions, both groups were together for the opening and closing sessions, and then we split off for individual workshops. And so the attorneys had workshops that were focused on case law updates and things that were very specific to their roles. And then we did some agency updates and talked about policies and those types of things, as well as other initiatives with the child welfare leaders. This was the first time that we have had an opportunity to bring these two groups together for this type of forum. September is Kinship Awareness Month, and we recognized that in several ways. It's really an opportunity for us to celebrate kin caregivers who step in the gap when parents can't care for their children, to provide stable and loving homes while their parents are unable to do so. So we hosted a couple different things. We had 4 educational webinars that we partnered with Children's Healthcare of Atlanta to do. And we focused on topics such as self-care, family boundaries, caregiver plans, and mental health. And we had over 200 caregivers that participated in those. We had 5 kinship celebrations across Georgia that really provided networking opportunities and a time to connect and share resources. So our caregivers with each other, and then us the opportunity to share with them. And we had over 130 different caregivers that participated in those. And then finally, our popular toolkit giveaway. We held those in 28 counties across the state and gave away useful household items. And we had 550 caregivers participate in receiving toolkits. And the next slide shows some photos of some of those stations set up. So we had kind of a drive-by operation for our kin caregivers to receive those.
What was in the
toolkits.
toolkit?
Household items, paper products, non-perishables.
Oh, okay.
Yep. Another thing that we have done recently, and I think this is our 3rd year in a row that we have done law enforcement meet and greets. So we asked all of our counties to host law enforcement in the month either of August or September to have an opportunity to dialogue with them and touch base. Some of them used it as an opportunity to do some training, but really an opportunity to just connect, because the work that we do is so interconnected with law enforcement on our front lines. Our case managers and law enforcement work together daily. So we feel like it's really critical that we have strong partnerships and wanted to create some effort to nurture those relationships. There's some photos from a few of our meet and greets across the state. So next we have a special retiree feature this month. Stephen Reed is retiring at the end of October after 42 years of service.
No, this is great.
With child welfare.
Oh, okay.
So we are super excited to recognize Steve. He began his career in 1982 as a food stamp eligibility worker in Fulton County, held several roles in Fulton County for 27 years before we snagged him in 2009 to join the state office team, where he has also served many roles, including special assistant to DFACS director, the director of quality management, and his current role as the director of the data unit and quality management. Steve has an absolutely remarkable way of presenting and explaining data in a way that everyone can understand. He's really made a difference in the agency, and I can say that we are better because of his service. We are going to miss him tremendously, and it is an honor for me to be able to recognize Steve today. I also want to share that I recently learned that there are 9 employees that have the same length of service across the employee retirement system. So active employees who are in the system with Steve's length of service. So at the end of October, that number will decrease to 8. But we are forever grateful for Steve and his contributions here.
We'll send some type of ticket or something.
Are you mumbling or are you saying something?
I think that the board should send someone of this.
Yeah.
That day, we need to send them make a resolution or something and send to them to be presented to the chair.
If we haven't already, we may have.
Yes.
What are y'all planning for celebration for him as an exit?
His unit is actively planning that. I don't know that they have finalized their plans,
Okay.
but they're planning something towards the end of the month.
But we could write a resolution, so
I think that'd be great.
that would be, I mean, just
Yeah,
for the board, side resolution for him.
just thank you for your
Yeah,
service
for your service.
Yeah.
and so. Okay, thank you. Great thought, Dave. Right?
We are continuing to prioritize technology modernization efforts within child welfare, and this is something that is done to help support our frontline staff to make their jobs easier, to free up time, remove administrative burdens so that they can spend more time building relationships and engaging with the people that they serve. Georgia Communicare is one of those efforts. It is a set of interconnected web portals that are designed to support and enhance our programs by connecting our case managers, court-appointed special advocates, foster parents, and parents. This system integrates seamlessly with Shines, which of course is our system of record, and allows us to ensure secure and efficient data management and communication. We are contracting with the University of Georgia School of Social Work to help us evaluate and promote Georgia Communicare statewide. It creates the opportunity, of course, for each of those parties to be able to see all of the things they're legally entitled to out of Shines, as well as for them to communicate and to share information with each other, particularly documents. In September, we hosted our first live training and Q&A for foster parents on Communicare. We were fortunate to have over 100 foster parents participate in that live training, but we've also recorded it, and so it will now be available moving forward for anyone that didn't get to see it, as well as new foster parents.
And you'll be able to keep up with who is taking that, who has reviewed that.
We can.
That would make sense to me. So you could know 50% of the people have done it or only 10%.
Yes.
And Mary, were many of the foster care homes impacted by the Hurricane Helene throughout Georgia? And if so, what did we do for them?
We've had some. We haven't had a tremendous number, thankfully, that were impacted. And we did have a residential facility, a small group home that was impacted as well.
Okay.
That facility had to move. They had 5 residents that they had to move to other locations. So they're a strong network and have several locations across the state, and we're able to relocate those homes. We have a feature in our centralized call center where foster parents, if they have to evacuate and change locations as a result of an emergency, can call in and report their whereabouts. And so we tracked that, and those folks have all been able to return home, the folks that did have to leave temporarily. So finally, in technology modernization, a few things that are under development for us. One is caregiver connection, and that is going to digitize the foster parent onboarding process and create a reevaluation portal. Of course, it will not digitize the training. The training will still remain in person, but just all of the forms and paperwork associated with the training process to get to full approval will be digitized. And we are working on foster parent reimbursement technology and digitizing that as well, which we know is a great need. We've had lots of requests for that over the years from our caregivers. And so we're very excited to be actively working on that, and hope to have both of those projects ready to roll out in 2025. And I'll continue to provide updates on them in the coming months. So thank you all for your time. And if you have any other questions, I'd be happy to answer those now.
I want to go back to slide 14. Yeah. There we go. Help me explain this between law enforcement and DFACS, and how does this relate with the juvenile court system? How we get all this tied together to where you got the case, you got to move with it, and we're either gonna, sometimes when we have the situation where we have to separate, take from the family and put in foster care or something else.
Mm-hmm.
So how does this work here?
So primarily with child abuse investigations, as you were referencing, right?
Yes,
And a lot of times we will work those together. So law enforcement may have an open criminal investigation that they're working, and we may have a child abuse investigation that we're working on the same family related to the same incident. So it is critical that we are partnering and working together so that we strengthen both of those investigations. Right? There are also times where we may reach out to law enforcement if we're concerned about a threat that may be present in a home where we have a new report of child abuse or neglect, and ask them to join us in making that initial response to the home. And so there they would just really be a support and partnering with us.
all right. I've heard some horror stories with this. You have a child and it's a bully in the home,
Mhm.
and he's there. He's staying with next to his aunt or grandmother, whichever. But he's a bully, and he's physically abusing, the caregiver. How do we interact with that? I mean, is that law enforcement? Is this with DFACS, or do we go back to court? Do we handle it? I mean, how do we solve some of these problems? Because this happens.
Yeah, and they're very complex situations. So we would have to partner with them, and we may bring in the Department of Juvenile Justice as well to partner with us and see what services they may have to offer, or if their intervention could be appropriate in that situation as well.
So, but are we limited? Does the law limit us to what we can do to protect the family or the individuals or the rest of the family? I mean, I'm at loss with this because this is all new, and I'm trying to get my head around it because I hear it from a lot of places that you have a particular child that is just discipline is almost impossible. So that's where I'm headed with this, and why how do we deal with that in DFACS?
Well, there's several ways, and of course, it's going to depend on, what the exact circumstances of that family are. But one of the other things that comes to mind as you bring up that scenario is what's called children in need of services, or CHINs. And a lot of times families that are struggling with a particular older child who may be displaying unruly behaviors will be referred to CHINs. Right. And so that's something that's held within the juvenile courts, and they explore what are services and options that can be available to that child and to that family. We have recently created an opportunity for all of our juvenile court judges in 58 courts across 58 counties across the state to participate in Unite Us, which is an opportunity for them to be able to connect those families to community resources. Unite Us rounds up all those community resources, and we are excited about where that can go.
You said you presented CHINs.
Mhm.
What is that? Is that an acronym for what?
Children in need of services.
Okay. Now, I got one last question. It's going to go to foster care.
Okay.
Foster care. How difficult is it for us? I understand placing a baby or 2-year-old or 3-year-old is fairly normal to be able to find a foster parent to take care of the child. But what happens to someone that's 12, 13, 14, 15 years old and have been in multiple foster units? What are recourses? How do we deal with that? Is there a way to deal with this other than, institutionalizing what? Help me with that.
Well, it's something that we are challenged with every single day. Older youth, particularly those that have challenging behaviors, right, are more difficult to find placements for. But we spend a lot of energy focused on what do those individuals need, trying to understand their behavior. A lot of times that behavior comes from trauma, and if it comes from another condition, we want to make sure that they have treatment, that they're getting behavioral health treatment. We have an amazing number of people that are willing to step up and help teenage youth and focus really all of their caregiving on teenagers to better understand them. But with that being said, it's something that's, we work on every day. And certainly it is more difficult to find placements for them.
Anything else? Dave?
Hmm?
You got anything else? You good? All right, so, it's great that y'all are doing the law enforcement thing, the permanency forum, those kind of things. It'd be great if you could let, the board know when those are gonna happen. Because if our schedules permit, we might be a part of that. I mean, whenever I go to one of those, whatever it is, you get a lot deeper perspective. And so I think I can speak for the board that I think we would, or I know we would like to know at least when they are and an address so that we can, get there. So I don't know if that's a monthly thing or I would guess you plan these several months in advance. And so if you could just be sure we understand the calendar, and that's something we could just send out quarterly, monthly, whatever basis. Can you help us with that?
Absolutely. And thank you very much for your willingness to do that.
All right. And then the other thing is I've got 2 or 3 questions. And this won't be not just for you, but for everybody. What's the biggest success that you have had that the department has had under your leadership in the last quarter? And then the second question that I want you to answer is, what is the biggest issue right now under your purview? And a status of maybe where you are on that, trying to solve the issue.
So, we're in the middle of recovery from one hurricane, and of course, we've got another one coming in, right? So that has certainly been something that's been top of mind.
I thought you said, though, that they pretty much that had been taken care of.
It has been taken care of, right? But that's been top of mind in my focus recently. So I'm very pleased with all the efforts of our team pulling together, right? And making sure that we had everything in place for our caregivers. So that really comes to mind for me right now as the biggest success. Now, we are still planning for, and John's going to talk about some of the disaster recovery efforts that are on his side of the house, and our teams will be working to support that.
Sure.
And we, of course, have been pulling a list of any children that we have in the state of Florida so that we can make sure that after Milton comes through, that all of those kids are safe, because we do have kids that are in relative placements across.
So we have foster children in Florida.
With relatives.
Across state line.
Yeah, we have children across state lines.
It's because when they go and live with family.
That's right.
Okay. All right.
That's right.
Okay. All right. And then the biggest problem you have.
So I call it a challenge, and I think that
Opportunity.
Yes, absolutely. I would say having enough placements for children in care with complex needs, right? And we began to touch on it a little bit earlier, talking about older teenagers that can be difficult to place. We've made tremendous progress, as you know, over the course of the last year with hoteling, and that's something that's used infrequently.
But we're not doing that anymore, though, right?
We're not doing it anymore, but there are times that a child still does stay in a hotel while we are waiting on a placement, right? But the number of youth that do that is very, very low. But that's something we work really hard on every day.
Okay.
And I would say it's still a challenge for us. So we're constantly looking at what are the needs and what are resources that we can develop and with our partners related to that population.
Follow-up question. How do we help you? How do we get what you need? That's, where are we? How do we assist? I mean, we're on a board. How do we assist?
So let me
Speak
think
up.
about that
You're
and get it back to you, okay?
You know what?
Maybe you can share that with us next time.
Yes, I
Yeah.
will.
I have a
I
long
will.
list.
That's important to, I think, all of us.
And I'll be sharing some information later that will be, you'll understand what we're saying there.
Very good. Thank you.
Mhm. Super. All right. Thank you. Who's next?
That's me.
Okay, there you are.
Yes, I'm here. I am John Holman, Deputy Commissioner of the Office of Family Independence. And I'd like to start my presentation with a little context around it. The folks that work with us to organize these meetings let me know what y'all wanted to see. And I was actually planning to give a presentation at a conference in Denver today.
Okay.
But obviously I'm not in Denver, but I was planning to send my Assistant Deputy Commissioner, Mary Barrett, who's over our field operation. Mary Barrett Yancey is her name. And she was going to go through the slides about, the staffing and the number of people that we have, because she's directly over the field operations unit within the Office of Family Independence. But I ended up canceling that trip because of the hurricane. And so, Emily, sorry, but I'm going to jump like 5 slides quickly to hit that first and then come back to the staffing piece if we have time, because this is, so important. And y'all mentioned it too, and we hit on it, or Mary hit on it briefly, but DHS is the first, or one of the agencies that's one of the first responders in the event of a disaster. My staff and her staff have been working together to staff the shelters set up by the Red Cross to house people that had to leave their homes because they were damaged, or they had to flee the area where they live. So that happened immediately after the storm, or probably before the storm happened, and then for the couple days afterwards.
You're talking about the foster homes or just the general public?
General public.
Okay, I didn't.
General public,
All right.
yeah, sorry, I should have made that clear. That's a good question. So, yeah, we've opened up a bunch of shelters in advance of Hurricane Milton too. So we've closed the shelters for most of the shelter activity around Hurricane Helene has ended, but we are reopening shelters now for folks fleeing from Hurricane Milton.
And a shelter might be a church or a school or whatever.
Yeah, with a
Whatever
lot
got
of
good structure.
wherever is safe to keep folks,
Right.
for sometimes a long period of time. So that happened immediately after the hurricane, and it's now happening again for the next hurricane. But there's a big operation that's about to kick off, which is why I canceled my trip to focus on that. I'd like to share that information with y'all today. The thing that we do immediately starting after, or immediately following a hurricane, it's okay, you can go ahead to the next slide, is replace benefits for existing SNAP customers or clients. So our existing clients, are issued benefits throughout the month. It usually starts around the 5th of the month and then happens every odd day to the 23rd of the month. So we don't send all of SNAP benefits out on the 1st of the month or anything. It's staggered throughout the month. But the hurricane happened on the 26th, which is right at the end of our issuance cycle for the month of September. And a lot of people lost power for a long time. And when you lose power, your refrigerator is part of that equation. So a lot of folks may have lost the food they purchased with the benefits that we gave to them. And so a big effort to replace those lost benefits is going on right now. Started immediately after the hurricane as well. Normally our clients will have 10 days to request replacement of benefits after a disaster happens. When they're very large disasters like Hurricane Helene, we can request a waiver from FNS to extend that time period out, which we have done. So now they have a full month to request replacement of lost benefits if they have a power loss of over 4 hours. Is kind of the criteria for that. So people who would have lost the benefits will be able to ask for that to be replaced. We can also request, and we already have, submitted a waiver with FNS to do mass replacement of benefits. So if we can tell the entire county was without power for 4+ hours, we can say, can you just, instead of everyone having to submit an application, let's just give everybody, and it's a percentage usually, somewhere, between, I think 70% might have been what we got in the last disaster. It's not 100%. We actually have requested for the first time 100% replacement because of the scale of this storm and process. If someone submits, if we get a mass replacement for 70% replacement, a customer can still submit an individual request for the remaining 30 if they've lost all. So we've requested 100%. Hope to hear back today about that.
You requesting it from Uncle Sam in Washington?
Correct. We have
Is that, which department does that come from?
It's under USDA. So within USDA, there's the Food Nutrition Service, which is FNS. Sorry, I should define the acronyms, but yeah, Department of Agriculture is the top department there. And then it goes to food and nutrition, services is FNS. So, we submit these requests through FNS. We've gotten approval for the replacement benefits, and we are hoping to hear back today about mass replacement, about whether or not that will be something they'll offer, which I do expect them to approve. It's just what percentage will be approved. I do not know, but we have made those two requests, and that's immediate relief for existing SNAP clients. And I'm being very clear about that because there's another program that I want to talk about on my next slide, which is disaster SNAP. So
Disaster SNAP.
DSNAP, is what we call the acronym for Disaster Supplementary Nutrition Assistance Program. So this program is for people who are not currently SNAP customers. So people who are low or moderate income households are eligible to receive 1 month's worth of benefits. So this is, there are some requirements. It's not just everyone in the whole state. There has to be a presidential declaration of individual assistance. That's what it's called. We call them IA, individual assistance, IA counties. And so currently, as of right before this meeting, they just added 5 more. So we have 58 counties in Georgia, 159 counties, 58 of them are under an individual assistance declaration from the president. So, we try to project this out based upon historical events, but it looks like, or we are currently planning for somewhere between 500 and 700,000 households to apply and be eligible for disaster SNAP. So that is a historic disaster SNAP operation. Like, I cannot overemphasize how big this operation will be. I'm expecting it, we're gonna break it up into phases. We've been advised by our federal partners at FNS not to do the whole state at one time, but we're gonna break it up into probably 4 phases where we focus on different regions of the state to provide this assistance. And DSNAP is not designed to be emergency relief. There are a lot of places that do, the hurricane hits today and tomorrow they show up and feed people. This is a long-term recovery program. So we don't start disaster SNAP, DSNAP until usually about 2 to 3 weeks after a disaster, sometimes longer depending on the situation on the ground. But the idea is that power has been restored to the area, water has been restored to the area, and basic infrastructure is back up and running because there needs to be food in grocery stores for them to buy. They need to be able to take it home and prepare it at home and then store it for we want this to last them a month or plus if they can, stretch the benefits. But, it's not a like right after the storm, but it is like once that support that does come right after the storm is gone, this keeps them going until they can fully recover. So, this will be large, and it's going to take more than OFI to do it. I think we'll probably need current projections. It'll take about 1,500 staff to support this effort over the next 2 months. So we are still in the planning stages of what it's going to look like.
You just pull people off different jobs in order to help from different areas.
Correct.
Okay.
I got one, we've been in Richmond County, we've got some areas, especially in this South Carolina, we also have it in McDuffie County too also. Some people are they're not gonna get their power on until sometime in October 19th, 21st, somewhere around there. It's gonna be later than that. I know we were without power for 8 days.
Wow.
So when does this, because I guess I'm going back to that 2 to 3 weeks after the fact.
Yeah, that's a good question. Yeah.
When is it? Because we have areas in Richmond County right now, they do not have power.
Right.
We still don't have any Wi-Fi or cell connections worth of hoot, but anyway.
Right.
So
a good question about timing and phases. That's why we're doing this in phases too, because there are pieces of the state that appear to be recovering faster than others, getting their power back because there was less damage or more, easily repaired infrastructure. So that's how we're planning out our phases, is based upon the recovery time. We actually have some pretty good tools available to us.
well, they're coming directly from Atlanta, or we got troops on the ground in Richmond County, McDuffie County, or Scranton, or wherever?
Sure. No, so there's it'll be a long answer. But let me,
That's all right.
yeah, that's
That's
okay.
pretty
Yeah,
much
yeah, for sure. So, what we'll do is we have to set up disaster snap sites.
Okay,
To support the disaster snap effort, we're actually gonna do a hybrid approach this time because we have some new technology available. So as part of the COVID effort, we got some funding to build a disaster snap online portal. So now our customers will be able to, it'll be what you think of as submitting an application, but we have to call it a pre-registration because an application doesn't truly happen until they're interviewed, because there's an interview component of applying for this service. But we're going to stand up an online portal where clients or Georgians can pre-register, and then they have to complete an interview to determine whether they're eligible or not, and they'll do it two ways. They can be in person at disaster snap sites, which we will be setting up across the state, or, and this is pending FNS approval, but they have signaled they will approve this, we're going to stand up, they're allowing telephonic interviews. So we can actually have a phone line that people can call into, and we can complete the interview on the phone. So we'll be able to we'll set up a site in Richmond County for folks to come to and apply and get the interview and get their benefit card in person. And we can also do it, the person who interviews them can be in Atlanta, doing the interview, or be in Northwest Georgia, even talking to them on the phone to kind of flex our capacity a little bit.
But not a Zoom call, it's just
a telephone
audio.
call,
Okay.
right? Yes. Sorry, did I answer your question?
as long as it's not Wi-Fi, because that ain't working.
Yeah. We're actually, building, there's getting a lot of like mobile Wi-Fi pieces right now. Our OIT group has been very helpful and of finding new ways to kind of make that work. But we do know that is one of the things. One of the reasons that infrastructure needs to exist is to be able to operate the program successfully. So right now we're looking at 4 phases, I think, is where our current planning is. We may have to go bigger too if they've been adding counties, over the course of the last 2 weeks, but looking at starting in the Savannah area because they were able to restore infrastructure the quickest. It looks like Valdosta is recovering a little bit faster, so hitting that area next. Then the Richmond area and surrounding Northeast Georgia, and then there's a group of counties in between those two areas in Middle Georgia that we have been told may be, in the later groups to recover. So that's our current phase plan. It changes every day as we learn more about the situation, as resources become available and things like that. But, it will be to spoil my answer for the question later, this is going to be the biggest challenge for OFI in maybe ever. But definitely in the past quarter, past year, and we'll be leaning on resources from other parts of the agency to help us do this, because we also have to keep all the other programs running at the same time. A couple more things to hit on about the disaster relief. One piece of DSNAP is, clients or people who are not our current clients will get the maximum amount. The SNAP benefits is not just you get SNAP or you don't. It's kind of a spectrum. You can receive, a lot of benefits or less depending on your income and resources that are available to you. But when we get approval for disaster SNAP, it automatically bumps all of our existing customers up to the maximum allotment for that month. So a little extra for our existing customers comes along with DSNAP and a supplement. And there are a couple more waivers I wanted to mention too. The next slide was intentionally left without data because I didn't know where we would be today. But the waivers that we have submitted, that the one about extending the time period for people to request replacement of benefits has been submitted and approved. We've submitted a waiver for mass replacement of benefits, which is pending approval but has been submitted and hope to hear back today. We submitted another waiver for EBT, electronic benefit transfer. The SNAP benefits cannot be used on prepared food normally. So like you go to the grocery store, you can buy food and prepare it at home, but we actually applied for a waiver within these IA counties for them to be able to purchase prepared food if they're not able to do that at their own home. So that's a little help for that situation as well. That was submitted and approved by FNS just this morning, or maybe yesterday evening, got approval for that one. We're also submitting, our big DSNAP program is a waiver itself to request to run that program, and the hybrid model surrounding it is also considered a waiver. And we have one more waiver where we're going to, the folks whose case is closed in September, we're gonna reopen everyone who closed because they did not submit a renewal or they failed to provide some piece of verification about their income or something else because they may not have had time because of the hurricane.
Mhm.
And then the folks that are supposed to submit a renewal in the months of October and November, we're going to waive some of the things they have to submit. If it's a periodic report, which is just a check-in at the midpoint of their certification period, we're gonna waive those for those 2 months. And then if they were supposed to do a renewal in October or November, we're gonna move those out and spread them out across a 6-month period. to give folks time to recover so nobody loses their benefits in, a bad situation as a result of the storm. So,
Wow.
a lot of work there that's going on to kind of keep that program going and to provide as much assistance to Georgians as possible in the way of food support. So we will be, that'll be a big thing that's happening, in October, November, and it may even stretch into December. Some of those efforts around disaster SNAP.
So how many homes were affected by, in a major way? Cause now we're not just talking about foster care and all that, we're just talking about everybody, right?
Yeah, this is everybody.
Right.
So those projections that I talked about, we removed the SNAP population
Right.
from that before we made our projections. So, I really think it's measured in, it's probably like 5 million. I don't know.
What's the population in Georgia?
It's 12 million, 13 million.
Yeah, Atlanta's 6, so
Yeah,
it's about
it's-
11 or 12, so
Yeah,
you're
we
talking about
have
half the
these-
state of Georgia.
Yeah, one of the tools I was talking about that we have to kind of track recovery is a power outage tool, and you could see a strip that just went up from South Georgia all up the eastern side of
Right.
Georgia. So really that whole area was heavily impacted. And we still see, places like Richmond are still, and a lot of middle Georgia is still in very bad shape.
Says that as they said, as the hurricane came through, you can just see the black behind it as it came
Right.
through.
Right.
And the eye went straight over Augusta. So you had a little calm and then it blew it up. So,
Well,
but anyway,
and most of and the people that you're gonna use to help the Georgians are sort of on the payroll for Department of Human Services.
Yeah.
Right?
Correct. So
generically. And then are you accessing volunteers?
Correct.
How does that work?
That's a good question. So there are some rules around the program. So there's kind of there's a couple different jobs that someone could do in a DSNAP operation. So interviewing clients and determining eligibility for the program is, I would put like top level, that's like a caseworker almost
Mhm.
level of knowledge. So that work has to be done by what's called a merit employee or a full-time employee with the state.
Sure.
But they don't have to work for OFI. They can work anywhere. So there are some folks that have moved on to other places, like Mary Havoc was saying, we trade folks back
Sure.
and forth. And so there are folks that have knowledge of the SNAP program in our technology systems. So we'll, first focus on OFI folks for that, and then reach out to people with experience to put in those roles. And then, we have a lot of training. It's pretty streamlined, the eligibility determination process for this. So we can probably loop some more people into that process too. And then maybe a step down from that, there are 2 other jobs where we have register people when they come in and stuff and make sure they've completed the pre-registration stuff and have submitted all the documents they need to and things like that. So we can put some staff, again, they have to work in our system, so they need to be state employees. And then there's another job where you actually generate the cards with the benefits on them. And that has to be, those 3 things have to be 3 different people
Sure.
because of the
Checks and balances.
Yep, security and fraud prevention, stuff like that. But there's a whole lot of other things that have to happen. So Just navigators. We have recently ordered, I was gonna do, remember the library kiosks that we talked about? I was gonna put those in our lobbies too, but I'm stealing all of the iPads that I ordered, and those are gonna become, we're gonna work the line and make sure people have applied. So we need people, traffic control, we'll call them navigators that are helping in the lines to register folks. And a lot of the kind of just operational things of, handling this kind of traffic. So, the phases we're breaking them up to are roughly like 200,000 people will have to go through these sites or interact with our virtual component. So we expect pretty heavy traffic.
Are they outside or is this gonna be in a building or something?
So hopefully most of it happens inside,
Okay.
but it does depend on the capacity of the spaces that we're able to find.
Sure.
David, your question about what can you do to help? If you know of any big vacant buildings that are in good shape, we are looking for about 58 of them. And that's serious. I'm not joking. We are in the process of site selection right now, which can be challenging because that's a lot of
You say
people.
big, how big?
As big as it can be. Like, for example, in Savannah, we're looking at like technical colleges usually have big gymnasiums, and churches are usually we have a pretty strong network of faith-based organizations that have, gyms or big areas where they hold events
What do
and
you
things like
want
that.
them to do?
Say again?
What do you want them to do? What do you need?
So really, we just need to use their space for a week. So the application period is 7 days. And so, or 5 to 7 is what we can do. And we're trying to figure out the logistics of that. The time period for each phase has to be the same for access, equity and things like that. So really, it's just, we need big places with parking. And we have emergency plans that the county directors that Mary oversees, put together and update annually. So we do have some sites in mind, but sometimes
I would think movie theaters, because very few people go to the movies during the day, and so that might be a great way. They've got usually air conditioning and those kind of things that can help. So that might be something to do.
Sure. No, that's a good, I'm not saying no to anything right now. People offer, but usually the biggest issues are parking and capacity. And, a lot of times when people have really big buildings, lots of parking and capacity, they're already using it for other things too. So that's been a challenge too. My current plan is to not operate on Sunday, to make more faith-based organizations available for sites. But we're not usually using like the church. It's usually a building near it and stuff like that. So that is something that we're in the process of doing that right now. We do have locations that were pre-identified as candidates. It's just confirming those were not damaged in the storm. That's been an obstacle. Making sure they have power, making sure they have internet. My dad's a preacher. His church is very nice, area where they have like meals and stuff, but there's like 3 plugs in that room. That's not okay. So there's a lot of like logistical things that go into selecting sites. Those are things that we're working through right now. So logistics and the planning and those pieces. So, I forgot why we started talking about this.
Sorry,
It's a lot. And, the last time we did it was 2018 with Hurricane Michael. So we still have some of those folks around, but we did lose a lot of that institutional knowledge. So rebuilding some of that too.
When are you going to, you need them now or you need them?
So we're going to run these phases 1 week at a time. So, our current goal is to start next week. Hurricane Milton may affect that timeline. That's a goal we're striving for. We also have to get federal approval for our plan, like I mentioned, through FNF. So we did submit a draft of our plan and they came back with a lot of questions, and we are answering those questions right now. And so we're giving them a demonstration of our system on Thursday. So it is possible that we get approval this week and can begin next week. It is also very possible that because of that federal approval process and the third hurricane now, I guess, if you count Debbie to come through, the Hurricane Milton may also delay planning, because our first phase was going to be in that Savannah area, but that is the piece of Georgia that is expected to be impacted by the new hurricane. So I would say the next 2 weeks is when it will start, and then we'll run it for a week in that area, a week, and a week is kind of how that will run. And that's,
So we need to have the basic, all the infrastructure basically up as far as electricity and internet, website, all that type of stuff.
correct. So, the county directors are working very hard. Mary mentioned they've been doing a great job, making sure our offices are coming back online, and now they're transitioning into helping us find locations within the counties where we can run these DSNAP operations. We can't do them in our existing offices. That is a rule. So it can't disrupt normal operations. So we do have to find alternative locations to do that. And we're really relying on our local, we have it's a big organization, and the local leaders are being engaged to kind of help identify places. But that's definitely an area where we will probably need help from a lot of folks, is either organizing volunteers to help with the support structures around completing that process and locating sites to actually do that work. Wow.
Had no idea all that was going on.
Yes, that's why I wanted to now I can go back to my staffing slides,
All right, what number slide do we go back?
I don't
to?
want to take, I know probably I just.
No, this is important stuff.
Most of the time that was allotted to me, but y'all will have the data here, and I can change it into the format that Mary Havoc presented if that is your preference. But just to run through these acronyms, which I assume is what Mary Barrett was planning to do. The CSA is our customer service associates. So those are our lobby staff that you'll see if you come into one of our offices. We have about 400 and a little under 460 of those. And that we have a career path just like she does within our economic support specialist series. So we have 1, 2s, and 3s, and they're kind of clumped the way you would expect them to, with our ESS 1s being people who have been here for a year or less. And then if you're successful at being an ESS 1 for 2 years, we move you into an ESS 2 position. And then if you're successful in that position for an additional 3 years, you're eligible to move up to Economic Support Specialist 3. And just like child welfare, you don't have to go to 3 to jump to supervisor. You can go to supervisor whenever you're ready. So supervisors, kind of vary a little bit, but again, trend towards the more experienced folks. And then above a supervisor is an admin, and then administrator. And then above administrator, we have deputy district managers, and then top field leadership. Mary Barrett has 3 deputies that sit under her. So this is kind of the distribution. On the next slide, I also have same data shown a different way. Just with bar charts showing you, again, it's kind of the same thing where you'd expect the lower positions have less seniority than the higher positions here. And I think there's another slide which shows the same data a different way, just showing you how they break out, again, with our more experienced folks being in those higher level positions. And I've hit on this in other presentations, so I'll just quickly go through this. The career path, I talked about how we had instituted career path. I added a piece to that since the last time we talked, which was to give salary increases to our supervisors and above. The jump from ESS 3 to supervisor was only 1 pay grade, which was not equivalent to the responsibility jump, in my opinion. So I made it two steps up in pay so that it's worth. So that's some feedback I got from the field, was it wasn't worth it to make that jump in responsibility financially. So change that to make that position more attractive and to get some more experienced people into a leadership role. We have a nesting program to help new employees, give them more support. We're starting this a next level coaching initiative, which I think I've hit on before with y'all, but it's really just to train supervisors to provide support to their employees, to transfer of knowledge down, kind of formalize that process. And we've been doing some things around hiring to make that we still need more people to meet our workload. And so we've created statewide hiring panels to make that process a little more streamlined. And we actually made a video that I think we're about to launch. I don't think we've launched it yet, but it's a video that kind of shows day in the life of an OFI caseworker. So we can share that with you when it's ready. And that was her slides there. But I can take questions now about any of the things or anything y'all would like to talk about now.
Well, we certainly know what your biggest issue is. And biggest success over the last quarter?
Biggest success. Another thing I think I talked about is something that was planned in a previous meeting. We implemented what we're calling an intelligent task routing system. And so, previously all of our work was assigned out round robin in the system. So like if we all knew how to work Medicaid, I would get a case, you would get a case, you would get a case.
Mm-hmm.
And that would happen with all the work that came in. So if 10 came in, 4, 3, 3
Right.
is how it worked. And they would just sit on our dashboards until we did them. We've changed that. So now we only get one at a time.
Okay.
And then if you finish yours before I finish mine, you get the next one, the next most important one, based on priorities that I can set at a leadership level.
Okay.
So it made it a little easier. Some work was getting lost in people's dashboards, and it was really hard to prioritize specific types of work. And so in this way, I can change the priorities whenever I want. Like if after this meeting, you told me, go get all the food stamp expedited applications done, I can set that to top priority and throw everybody in that work group. And all that will be done is expedited food stamp applications. So
you can change on a dime then.
Yep, it introduced a lot of flexibility that used to be manual work to move work around. So that's been very successful. It has uncovered some training opportunities where it's going to clean up a lot of our system because they just found people weren't closing things out correctly. And if you don't close it out, you don't get the next one. And so that was causing problems throughout, like with our reporting.
It's advantageous not to just finish one because the next one's coming.
Yeah, well, if they don't get a new one, we know too.
Yeah,
so
right.
We saw the expectation of the number of tasks a person should go through in a day, but now the system's forcing them to do them right. And it's really, there's just the flexibility and the efficiencies of it. We're already starting to see a lot of value there. So that's been very successful. And it's an ongoing process. We have a phase 2 that's adding a lot of reporting that's coming in November, early mid-November. So very excited about that success and continued gains that we'll have over the next couple of months and years from that.
Great. Thank you for your report. Shall we move on? Aging services?
Good afternoon.
Hello.
My name is Christine Williams. I am the Georgia SHIP team lead, and I'm here to talk to you about a program called the State Health Insurance Assistance Program. Next slide, please. This program is a nationwide program. It is administered here in the state of Georgia through the Division of Aging Services, but is also administered through the Department of Insurance in some states here in the United States. Next slide, please. So our program, we provide education to Medicare beneficiaries. So we actually help folks understand their health insurance. So health and drug programs in reference to Medicare beneficiaries. So we're focusing on folks that are 65 and older. If they are under 65, they've been deemed disabled by the Social Security Administration. And then also folks with end-stage renal disease and other like Lou Gehrig's disease are able to be eligible for Medicare at any age. We provide outreach and counseling to folks. We also help individuals apply for financial assistance programs like the Medicare Savings Program, the Extra Help Program through the Social Security Administration. We also educate folks on wellness and preventative services. We help people with appeals and grievances, and we provide impartial and personalized counseling for folks. We do, as I mentioned before, have an outreach and education component. So we go out into the community and do presentations. We actually attend health fairs and benefit fairs, and we're also seeking community partners. Next slide, please. So basically, when dealing with Medicare, we talk about all 4 parts of Medicare. And as you guys are probably already aware, Medicare open enrollment starts next week, next Tuesday. So October 15th to December 7th of every year is when Medicare beneficiaries across the entire country are looking at their health and drug coverage and deciding whether they want to keep that coverage or switch into a new plan. And so we educate folks about Medicare Part A, hospital, Part B, medical, C, Medicare Advantage plans you see advertised on TV, and then also prescription drug plans. Next slide, please. We also educate on preventative services. So we're talking about services that folks are entitled to if they have Medicare. So you see here a list of Medicare preventative services that people can utilize during their having Medicare. And so we educate them to make sure they try to stay as healthy as possible. It includes everything from COVID vaccines, shingle shots, things like that. Also, welcome to Medicare preventative visits and yearly wellness visits. Next slide, please. So as you see here again, Medicare starts next week on Tuesday and ends on Saturday, December 7th. And that's an opportunity for folks to look at their coverage, change, and switch. Our program exclusively helps people enroll into these plans. We help them make comparisons. We help them decide what is it that they would like to do and for the upcoming year, starting January 1st of 2025. So again, we encourage folks if they have Medicare, which is that red, white, and blue card, to look at their coverage, see what changes they need to make, discuss anything that they need to discuss with us. We also help them with coordination of benefits. So if you have an employer-based plan, so you've retired and now your employer is helping you with your insurance, also VA benefits and stuff. So we help people kind of understand how does it all work together. People that have marketplace plans, anywhere from 19 to 64, and also folks that have Medicaid, because the Medicare Savings Program is a part of that. Next slide. So some of the financial assistance programs that we help folks with is the Extra Help program that will reduce, it's a subsidy program, it will help people reduce their out-of-pocket prescription drug costs through the Social Security Administration. The other one is the Medicare Savings Program, which is through the Division of Family and Children's Services. And then also Medicaid, of course, the Department of Community Health and Division of Family and Children's Services. So we are actually helping people apply for the applications right online. We help them create accounts on the Georgia Gateway website, or we'll go directly to the Social Security website and apply. Folks can apply again in person or over the phone. Next slide. So this is our impact in reference to how many folks we are serving. So here in Georgia, the number of Medicare beneficiaries is growing. And so we're close to about 1.8 million Medicare beneficiaries here in the state of Georgia. And so it's for our program, we are always looking for volunteers. We are a volunteer-based program, which means that we onboard volunteers, we train them about Medicare, and then they in turn go out into the community and educate folks about Medicare. And so what you'll see here is that for the number of folks that we're able to reach with our program, basically, is that we're always looking to increase that number. So we're just a small portion of being able to educate people about Medicare. So we're always looking for help and assistance in reference to that.
And how many people on Medicare in Georgia?
So how many people are, so about 1.7 million Medicare beneficiaries here in the state of Georgia. And that number is growing. When I started with the program, it's about 1.5
Okay.
and now about almost 1.8. Yeah.
Okay.
So
Everybody's getting a little older.
yeah, I know. Okay, next slide, please. We also receive funding, which is called the Medicare Improvements for Patients and Providers Act. And this is additional funding to help exclusively in financial assistance programs. And so you'll see here that we take extra time. So our counseling sessions can last anywhere from a quick, 5-10 minutes, all the way up to well over an hour that you are talking to folks, kind of helping educate them about Medicare, actually enrolling them. So we utilize the Medicare.gov website. We can create accounts for folks, meaning that we walk through a 4-step process. We get the list of their medications, we look at their pharmacies and see which plan will be best for them in the future. And so that's really where our goal is, to really empower people to kind of understand the system, make a good decision about their health, and then know what changes they have and what opportunities they have in the future. So Medicare open enrollment is an annual timeframe. So October 15th to December 7th, there are multiple timeframes throughout the year for Medicare beneficiaries. So for instance, in January 1st or March 31st, if you're already in a Medicare Advantage plan, you can change and switch one more time. So again, it is going to be confusing for folks, you know, initially when they're kind of getting onto Medicare. But once you're on Medicare, you can kind of understand what your options are, whether you're in original Medicare or a Medicare Advantage plan. So this additional funding that you see here for Medicare Improvements for Patients and Providers Act allows us to do even more work in reference to kind of taking the time to educate folks and enroll them into financial assistance programs. It also has a component about preventative services too. Next slide, please. So this is the, so this is the number of reference to folks that we're helping with extra help and Medicare savings programs and applications. And then the next slide you'll see here is we do have community partners that we actually contract with here in the state of Georgia. And so we have partners around the state that are doing the same type of work. So we have local coordinators, they too may have staff, and then they are managing volunteers also. So at the state level, we're a small team, we're about 13 folks that are actually running a call center. So folks are calling in Monday through Friday from 8 a.m. to 5 p.m. We're providing them service, returning calls, emailing folks, just making sure that they have the information they need. And then these are community partners. They're out in the field, out there helping us kind of spread the word about the program.
With all the different aspects and the different people that are participating, whether they're vendors, whether they're employees, whether whatever, how do you get them all saying the
same thing? That's correct. And so that is where our education comes in. So we have online training modules that are provided to us by the Administration for Community Living. And so that is the federal agency that administers this program. We also work closely with the Centers for Medicare and Medicaid Services. So they are providing training for us too. So they have annual Medicare open enrollment boot camp trainings, right? So webinars, trainings, online modules. And so that is how we continually educate it. And it is challenging because education in itself, people's understanding of how that information is. So we really try to make sure that folks understand our certified Medicare counselors are the only ones that are able to enroll folks into plans. Otherwise, folks can help at benefit fairs, stand behind the desk, hand out flyers, things like that.
But to be certified, you've got to pass a test.
That is correct.
Based on
that
whatever
is correct.
you're supposed to know.
That is correct. So we have an online module system that they have to do. They have to read the Medicare New Handbook. They have an oral exam, written exam, and an annual recertification.
Cool.
And so this is our phone number and for Medicare, and that is it. And I'll put some flyers for open enrollment.
Oh, good.
So we're always seeking help, basically, spread the word about the program, let folks know who we are, what we do, and we're here to help.
Something personal that happened to me was, you know, everybody has to sign up for Medicare A when you get to the age, but then you get choices on B, C, and D. But they sent a letter. Anthem is the insurance company. They sent a letter and to an old address where and I didn't.
You didn't receive it.
I never saw it, and I didn't re-up, or I didn't say I didn't want to be.
Right.
And so my wife was having some tests done, and all of a sudden nothing was getting paid.
Right.
Through Anthem because Anthem shut it off.
Right.
And so
the Part B does have a monthly premium. That's what you're referring to.
Right.
Yep.
Yeah.
Exactly.
And so nothing was getting paid on the insurance side because they were already pushing it to be, because they automatically assumed
that's right
that if I didn't say I didn't want it,
you have to decline it.
You have to decline it.
You have to decline it.
It was like,
yeah, you have to decline it as a monthly premium.
at least I know who to call if there's a question.
Yes, that is correct. Call us. Absolutely.
We appreciate you helping everybody not be so confused.
There you go. Very good. Thank
all right.
you.
Thank you. Anna and Shannon, right?
Yes.
Who's who?
Shannon.
Okay, all right, great. Thank y'all.
So again, I'm Anna Wall, and I am with the Division of Child Support Services, and I am the project manager for the SAVES grant. SAVES stands for Safe Access for Victims Economic Security, and it is a grant that we were awarded by the Federal Office of Child Support. And we received over $1 million to operate this project over the next 5 years. The goal of our grant is to provide services for customers who are experiencing domestic violence so that they are able to apply for child support safer. The team has partnered with the Georgia Commission on Family Violence to help us implement new screening protocols, expedite legal processes for customers applying, and work with other domestic violence agencies throughout the state of Georgia to help provide the services safer. We are also partnering with the Waycross Family Justice Center and the Macon Family Justice Center, where we will have 2 navigators at each site. When customers come in, the purpose of the Family Justice Center is a one-stop for customers in need, victims who are experiencing violence, abuse of any kind, so that they only have to tell their story once. So when the victim comes in, they will be able to work with DFACS, child support, legal aid, law enforcement, and we will also be able, the room on the right-hand side with the white tables and monitor, that is a courtroom. So victims who are experiencing domestic violence can have their court hearings there and not have to be in the courtroom with the person who caused harm. So it is a great access for us. Next slide. Some of our accomplishments for 2024 is we have an advisory council full of different staff and people in the community who are able to help us with issues as they arise serving customers with domestic violence. Mr. Brian Horn, who is down here at the bottom taking pictures, he helps us implement our website. And this site is for customers and staff where they can go and find resources in their counties. It covers the whole state of Georgia. And they also have a number listed there where services are available 24 hours. So if they're trying to leave a situation, they can find services safer. Next slide. Some goals that we hope to continue to grow on is lived experiences. This is one of the needs, Mr. Smith, that you had asked us to identify.
Right.
We need customers who currently have child support cases that are experiencing domestic violence to be on our councils to give us feedback on how we can improve child support services to make sure they're safer for them.
Wonderful.
So we're in the process of figuring out how to reach out to those individuals without causing more harm and alarming them, but also having them participate with us. Next slide. These are some of our top partners that we've worked with over the past 2 years. Macon is One Safe Place. Sur Familia is the Latino community. The Family Justice Centers. The Magnolia House is a shelter. Ahimsa House is a pet rescue. So if you needed to leave your home for fleeing from abuse, they would house your pets, place them in fosters homes for the pets to go to until you have a safe location.
Whoa.
We also have Raksha, which is
How do you pronounce that? How do you pronounce that?
Raksha.
Rasha. Okay.
Raksha, yeah, and it has a really neat meaning. It stands for protection.
Okay.
And they serve South Asians throughout the state of Georgia, and they're helping us look at how we can serve the immigrant population as they come through. And then lastly, the Georgia Commission on Family Violence, who's helping us with our training needs for DCSS staff and the legal system. Next slide. And again, this is the website that Mr. Horn helped us develop. We have a QR code that customers will be able to tear off of a piece of paper in the lobby and take it with them in their pocket that they can use later when they're safe if they need to. And our contact information at the bottom. And again, our website, where if you just wanted to write that down, you would have it as well. And the screenshot on the left is what our website looks like when customer and or staff go in to access it. And that is it for my portion.
Okay.
Thank you.
Sorry, any questions? I was so excited. Good afternoon. I am Shannon Longino. I am the outreach manager for the Division of Child Support Services. I have the pleasure of overseeing our fatherhood program, parental accountability court program, our prison reentry and prison paternity program. I'm happy to share with you about our fatherhood program and our parental accountability court program, which I will refer to as PAC going forward. First, I would like to start off with our fatherhood program. So the fatherhood program currently has a fatherhood manager, a business support analyst, 7 fatherhood supervisors, and 46 fatherhood agents. This team is charged with providing employment-based information for our customers. And when I say employment-based information, we want to get with our customers, understand what their barrier is to not paying child support, and provide whatever resource that we can provide to them so that they'll be able to get back on their feet. The goal is to intervene before our customers get to the point of where there may be court intervention. So if our customers are placed on child support, we want to catch them before they're at the point of contempt. So this program is for those individuals. What this program does is connect our participants with resources throughout the state of Georgia. The goal is to help them get to self-sufficiency by educating them on financial opportunities, making sure that they understand what emotional support looks like, and to encourage parental involvement. Next slide, please. Some of the accomplishments of our fatherhood program. We've had some accomplishments this year. As far as enrollment, we've had over 500 people to enroll in the months of February, April, and May of 2024. We've had an accomplishment with completion of our program in May of 2024, 221 individuals completed the program. And then some of our expansion, we are venturing out into the technical colleges where we'll have a fatherhood agent located at the technical college to try to see if there is a population there that may need our services. And then our community partnerships. We have a great community partnership with the Mega Sci Fi, where they help us with what we call fatherhood conversations. So every so often we will talk about matters that are related to fatherhood, invite the community, allow the community to ask questions, and just make sure that we are engaging with them in the manner that they want to be engaged. Next slide, please. Some of the amazing things that our fatherhood program has done since they have started, and this is our data as of last fiscal year, we've served over 9,000 children. 37 of our fatherhood agents across the state was able to help us in serving those 9,000 children. We've deemed that over 70,000 of child support cases are considered to be hard to serve. So for that, that tells us that this is the population that we need to be targeting. Since last fiscal year, we've had over 4,000 individuals to enroll in our fatherhood program and over 1,600 to successfully complete the program. Of our participants that have enrolled, we have 1,298 who were offered our GED or short-term training resource program. Next slide, please. The next program that I would like to share with you on is the Parental Accountability Court. So that is a lot. So if you don't mind, I'll refer to it as PAC going forward. This program is a collaboration with our Superior Court judges throughout the state. And what that means is that for every court that we have established, we have a Superior Court judge or someone that they designate to oversee the program. It is an alternative to incarceration. So the first program that I talked to you about, fatherhood, is pre-contempt. So you should not be in any legal jeopardy with that program. But some of our customers need assistance and they may make it to the point where they are
at the point of possibly being eligible for contempt. So this program is for that population. We do not want to incarcerate anyone. So we want to make sure that we are providing some type of resource to address the real reason of why our customers are not paying. One of the goals of this program is to increase parental accountability, self-sufficiency, and to collect child support collections. Next slide, please. The PAC program is a team approach. It consists of a PAC judge, a PAC coordinator, and a legal attorney. Sometimes it is with our county DA office or a SAG. And then we also have our local office. That is where we get our referrals from. But also a part of our team is the community. So once an individual is referred to the program and has agreed to participate, there are phases that the program consists. You have our intake, phase 1, phase 2, and graduation. Intake is where we get a lot of the basic information that we need to know, like what resources this person may need, what barrier they're experiencing. At intake, we also release their license, and that is something to let them know, is that giving them that incentive. Like, we understand that without your license, you may not be able to get to where you need to go for employment. So if we release it and couple that with some of our services, we're hoping and wanting to work to get them to self-sufficiency. After our customer has completed intake, we move them to phase 1. This is where we meet with them on a weekly basis. They go before a judge on a monthly basis. We give them referrals. We're getting to know what it is from their purview and from our purview of what they need to get back on their feet. They're expected to make payments on this phase. We understand that it may not be the full payment, but we're coaching them on, okay, you were not paying anything for 3 years. Let's start off with something. So we are expecting payments in phase 1. After they have shown us some growth, we move into phase 2, where we don't meet with them as much. Instead of weekly, we may meet with them bi-weekly. Depending on the growth that the judge see, they could be excused from court. The meeting can be via, we use Teams, so it could be a virtual meeting. We continue to provide resources because some of the barriers are extensive, so you may still need additional community support. After you have completed all of the goals that we have outlined in your case plan, and you have made a minimum of 6 consecutive monthly payments, we consider you from graduation. And with every step, it has to be a judge's approval. So we are presented to the judge. This is the person's barriers. This is what he's done. He's made this amount of payments, and we're requesting that he be eligible for graduation. The judge says yes or no, and if he says no, give us the reason, and then we continue to work on whatever it is the judge wants us to work on. If the judge says yes, then we have a celebration. And it truly is a celebration. It's the best part of my job, where we could, in a formal setting, talk about the challenges, talk about how it started off as child support, but it really ends at something totally different, because those barriers are not only attached to child support, it's things that are affecting their lives. So we invite the community. Sometimes we feed them, but it is a great opportunity to see the work that the graduates have done. Next slide, please. Some of the accomplishments of the PAC program. This is our 15th year of PAC. So we're celebrating that milestone in itself. And in the 15 years, we have received a national award in 2018. The National Child Support Engagement Agency gave us the Innovative Partnership Collaborative Award. Some of our goals, we want to be statewide. We're in 44 of the 50 circuits, judicial circuits in the state. So we want to be in all 50. And we also want to increase community resource collaboration. Your question about what have we done well and what do we need to do better in, our resources are limited, and it depends on the area that we serve. So in Metro Atlanta, transportation is really not an issue.
Right.
But if I go to the mountains, it is an issue. So that is one of our biggest issues that we have tackled. And the success is that same thing. We found a workaround. Another state agency, Department of Human Services, has a transportation. So we use DHS transportation to try to get to those hard to reach areas. We're still working out some kinks there, but the issue is transportation, and how we've handled it was reach out to our partners that's right next door to us. So we want to increase more community resource collaboration. We still have other areas like housing that we, often our customers will need assistance in. So that is another area. And then this last goal, these are our judicial circuits that have reached $1 million or more in collections. And that is their child support collections. And remember, the individuals that the PAC program work with are people that normally do not pay.
Right.
So for these circuits to have reached $1 million, to me, it says that the program is working.
Did that automatically go to the people that have not gotten, the money from their spouse?
Yes. Yes. Next slide, please.
So it's a pass through. Y'all keep a certain percentage of that money and all that.
No, we do have like small fees, like an application fee, but the majority of that payment does go to the customer.
Thank you.
Next slide, please. And then some stats about the PAC program. Since the program started in 2009, this data is as of the last fiscal year, 2023. We've serviced over 7,000 customers. We've assisted, through serving those customers, we've assisted more than 17,000 children, and we've collected over $30 million in collections of child support. And that is just our map to show where we are and where we need to get. The gray area are the judicial circuits that we're not in yet, but again, we're actively trying to get there, just so that you can see we reached throughout the state of Georgia.
What has been the reason why that you don't have certain circuits?
There are a couple of reasons. In some of our smaller circuits, it is not enough time to handle their current cases and then pick up PAC.
Right.
The other circuits, I know after the pandemic, trying to figure out what their court schedules will look like as far as will they stay virtual, will they go. So some of it is a holding pattern.
Right.
But we are we're gonna get.
Okay.
Next slide, please. And then I wanted to share success stories. And I don't want to mess it up, so if you don't mind, I will read them. Okay. So on the left, it's an accomplishment while this customer was in child support. So this is a notable success for the fatherhood program. This customer obtained his CDL, expunged his criminal record, and found stable employment, allowing him to meet his child support obligations. Great. So typically fatherhood is no longer than 90 days, but of course we have caveats to that. So in 90 days, he was able to accomplish that. For PAC, the accomplishment was this customer earned her GED, secured a CNA license, found employment, and was able to afford childcare. All significant milestones that enable her to regain stability and support her family. So the PAC program, you're in it a little bit longer because remember, those are the ones that have those could have those hefty barriers. So they could be in that program up to 18 months. Next slide, please. And now I thank you all. If you have any questions, I'll be more than happy to address them. But here's my contact information for fatherhood and for the PAC program.
Wonderful. Thank you. I did a good job.
Thank you.
All right, so I guess we have administrative reports. So it's my understanding maybe at the next meeting, you won't have to jump around and get into a certain seat.
It'll be
Is
less
that
of a
right?
tight space, yeah.
Well, I think y'all are doing great by Musical chairs. It'd been fun if you just put one less chair than was really here.
Yeah, I'm ready to figure it out.
Figure,
Problem solving.
Barbie did my chair, I tell you that. All right,
So, good afternoon. I am Christopher Henry, the Associate General Counsel here with the Office of the Inspector General. I've invited Beth Vineyard, who's on the right of me, who's the RCCL, and that's Residential Child Care Licensing Director, to join me to address any questions you may have after I've completed this presentation. So, in this last legislative session, what we saw from the General Assembly was that they had passed two significant bills. SB 377, which relates to qualified residential treatment programs, and HB 1201, which relates to commercial sexual exploitation recovery centers. And I'll refer to them as QRTP and CCIRC, because they are a mouthful. RCCL, which is the Residential Child Care Licensing Unit, has been actively engaged in researching and drafting updates to our child caring institution rule set that are impacted by the new laws. During our rulemaking process, courtesy copies of the rules drafts were shared with RCCL staff, OIG leadership, DFACS leadership, Office of Health and Law and Policy, DCH, DJJ, Office of General Counsel, and certain CCI providers, all to gain an informal review and feedback. I want to say that the feedback has all been positive. So I'm proud to sit here today and to discuss with you the proposed changes to the rules. And since you all have a copy of the proposed changes, as well as a copy of the synopsis, I won't bother to go through every last amendment or every last.
we appreciate that.
I will shorten it up for you. All right, so let me take you down the roadmap. So today, I'm going to review the rule change procedures. I'm going to discuss the rules for the initial approval to publish the child caring institutions, or CCI, the maternity homes, referred to in MH, and then make a request to the board. Next slide, please. The rule change procedure is the board considers the motion to publish the proposed rule.
Mhm.
Then there's a 30-day public comment period, which is followed by a public hearing. And then a motion for final adoption of the proposed rule. And then we'd send the final rule to the Secretary of State. Next slide, please. So on the left, you'll see the rule section, and on the right, you'll see the highlights. So as you'll notice, we defined QRTPs, which I mentioned to you before about the bills that were passed, and as well as the Commercial Sexual Exploitation Recovery Center. Now, both of those were identified as child caring institutions. So we also had to update the definition for a child caring institution. We've also removed policies and procedures for periodic rotation of board members. Next slide, please. We've also referenced the Georgia Code instead of detailing crimes and provisions. And we've clarified that no CCI can have more than 16 residents unless it's been approved by DHS or RCCL, excuse me. We've also required a CCI to be licensed if it has multiple separate living units on the same premises, providing care to a combined total of 6 or more children effectively on 1/1/2025. Next slide, please. We've instilled a new rule, a new provision that a QRTP must obtain and maintain accreditation. We've also done the same thing for CCIRC, except they have to do with a certification. Now, if that accreditation or certification is not maintained, what ends up happening is that they would lose their license as either a CCIRC or a QRTP. Next slide, please. We've also eased the qualifications for the director position. Next slide, please. We've also eased the qualifications for the human service professional position. We've also eased the physical exam provisions by increasing the number of days in which you can complete a physical exam. Next slide, please. And we've added all new provisions related to QRTP. Notably, the next line, we deal with the qualifications for QRTP, and I won't mention all of them, It's a mouthful also. But you must be licensed as a CCI accredited, have a trauma-informed treatment model, have registered or licensed nursing staff and other licensed clinical staff. Next slide, please. QRTP pushes a heavy family involvement in the child's treatment plan. That should be in accordance with the child's best interest. Next slide, please. We found that we had a lapse well, we won't call it a lapse, but when it comes to behavior management, we found that we weren't allowing parents to be involved in the discipline process of their own children. So we figured that we would then correct that rule. Next slide, please. We found also that we needed to clarify that CCIs that were caring for 13 or more residents with a valid service permit, they had to abide by the rules regarding food safety, preparation, and storage. There's no co-sleep or bed sharing, and when with respect to all vehicle inspections, they must be now done on, or they would be done on a department issued form that must be certified by a qualified individual. Next slide, please. And here we are at the maternity homes. We defined commercial sexual exploitation recovery center and the maternity supportive housing residence. Next slide, please. We also then again prohibited the co-sleeping or bed sharing. And we also then again dealt with the issues of the vehicle inspections being done on a department issued form that must be signed by a qualified individual. Next slide, please. So the public comment period is from October 10th of 2024 to November 10th of 2024. The public hearing will be October 29th of 2024. Next slide, please. And now I'm gonna make a request to the board for the motion to publish notice of the rulemaking when it comes to the child care and institution rules and the maternity home rules and regulations. Next slide, please. Any questions?
Not from me. Thank you for keeping up with all that.
Yeah, it's a lot.
It is a lot.
To read the whole thing.
Yep.
Is there a purpose? When I say purpose, are we just correcting caveats that slip through the cracks with this? These adapt and these rule changes, or is it something that we're gonna have unintended consequences in the future, or we're trying to stop unintended consequences? Which is it?
Well, I think there are certain caveats. I think namely, for example, going back to not allowing a parent to discipline his or her own child. That is something, that's crazy. Yeah, you kind of expect that we wouldn't have to set out a rule, but we do have to set out a rule for that. So
another example of that is having to come up with a rule that the children can't sleep with each other.
Yeah.
I mean, duh.
Well, the co-sleeping one really is also about, with a parent or something. You have a parenting youth, having them not share a bed with their infant child.
Right. We
So
know how the death
right,
that comes
unsafe
from that.
sleep and
Yeah.
things like that.
Some of these are clear, but I mean, some of them are kind of, that's the only reason I was asking. I mean,
Well, I think some also came from law changes. So introducing QRTP and CSERT, those were just created by this last legislative session in those two laws. So we definitely needed to put those new requirements of those laws into our rules and regulations.
Okay, just cleaning it up. Yep. All right. So,
we have meeting break.
at this point, if there are no questions, then we appreciate y'all's explanations.
thank you.
And we consider a break now. If y'all want to have a break, we can have a break. If you don't, we can just forge on. We good?
I'm good.
Everybody? Okay. All right, let's forge on.
Let's go for it.
So, all right, so, at this point, we'll just, consider this residential childcare licensing rule changes. There's two of them, so I'll start the first one.
Randy,
Yeah.
call to order.
Yeah.
Oh,
board
okay,
meeting.
call to order, sorry. The meeting is officially called to order. Is that
That's
okay?
perfect.
All right, good, thank you. Oh, I guess it says call to order, Randall. Okay, good. Sorry, I missed that. All right. I'll remember that next time. All right. So we want to consider these residential childcare licensing changes. And so, the board will now consider the proposed rule changes from the residential childcare licensing unit related to Rule Chapter 290-2, Rule 290-5, 290-2-5-.01, and 292.5.23 rules and the regulations for child caring institutions. Is there a motion?
Mr. Chairman, David Barbie, I move that the proposed amendment to Rule Chapter 290-2, Rules 290-2-5-.01, 290-2-5-.23 of the rules of the General Georgia Department of Human Service entitled Rules and Regulations of Child Caring Institutions be published for 30 days for public period comments.
Is there a second?
I second that. Monica Walters.
Wonderful. Thank you, Monica. All right, so it's moved and properly seconded, and that the proposed rule changes from the residential child care licensing unit be approved for publishing for a 30-day public comment period. Is there any discussions before we take a vote? No discussions? Okay. All right, so let's take a vote now. So all those in favor? Say aye. All those opposed? Okay, great. We're almost too fast for y'all, but thank y'all for saying that. All right, any opposed? All right, motion carries for the first rule change. All right, so now the second rule change is residential child care licensing rule change for maternity homes. All right. The board will now consider the proposed rule changes from the residential child care licensing unit related to Rule Chapter 290-2, Rules 290-2-29-.02, 290-2-29-.04, and 290-2-29-.21 rules and regulations for maternity homes. Is there a motion?
Mr. Chairman, I will make that motion. I move that the proposed amendments to Rule Chapter 290-2, Rules 290-2-29-.02, 290-2-29-.04, and 290-2-29-.21 of the rules of the Georgia Department of Human Services entitled Rules and Regulations for Maternity Homes be published for a 30-day public comment period.
Dave Barbie seconds the motion.
And the board member was Monica Walters that moved initially. All right, it has been moved. It's been moved and properly seconded that the proposed rule change from the residential child care licensing unit be approved for publishing for a 30-day public comment period. Is there any discussion? If not, then we'll just take a vote. All those in favor say aye.
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 Good, y'all right on cue there. Thank you. All those, anybody oppose these rule changes? There are none. So the proposed changes are verified. Right. So next thing we've got is the minutes approval vote. All right. So the July 23rd and August 20th meeting minutes have been distributed to you. Are there any corrections? To those meetings? All right. So is there a motion?
So moved.
There you go. Good. All right. At least you don't have to read a bunch of stuff, right? Okay.
Thank you.
All right. Yeah. All right. Well, you might need to read this out here.
I move that the Board of Human Services minutes for the July 23rd and August 20th meeting be approved.
All right. Anybody have a second?
David Barbie seconds.
All right.
Whatever.
Beat you to it there. Okay, good. All right. So all those in favor, say aye.
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 Well, y'all weren't quite together on that one.
We're trying.
I know. All right, so, thank y'all for that. That does pass. Anybody disapprove on that? All right, so it does pass. All right, so now at this point, it would be time for the commissioner remarks. You want to share whether, at this point, is commissioner on the line?
If she is not, if you guys do have any questions specifically for her, I have an open line to her, so feel free to find me after this meeting and I can get those over to her so she can follow up with everybody.
And it's my understanding that the notes that, or the things that she was going to share with us, she will just distribute an email to us about those.
That's fine.
All right, within the week. All right, good. All right.
And then this is the committee.
Oh, good. All right, so got the other, some new business. I know each one of y'all have, Becca has discussed with many of you about the different committees that we're gonna form. And we're excited about that. And several of our board members have expressed the interest in serving on specialized committees. And so based on that feedback, I've got the two committees that I'll share who we put where in just a second, but it should be consistent with your interest and your passion. And so I'm excited about this. And then at this point, let me share that there's two committees. One, the DFACS, or Office of Child Welfare Committee, and that would be Lisa Hamilton, Scott Johnson, Doug Aldridge, Richard White, and then Dave Barbie. And then the second group would be Aging Services Committee, and Wes Lewis, Jack Williams, and Monica Walters. And then, and so what we're going to do as these committees is we want the committees to meet at their own convenience. So once y'all accept, and if I don't hear that you didn't accept it, we'll assume that you did accept the committee assignment. And then as chair, I wanted to be at least involved in both of them. So, but I don't want to, I'm not going to lead the one. So you'll have to determine who's going to be the chair of the committee and consistent with when you're going to meet and goals and specific things. So, but we're excited about this because just the spirit of these committees, one of our responsibilities in the bylaws is to represent the different members in Georgia that are utilizing these services. And so we want to help be a part of that and be able to be a frontline communicator. And that's sort of where when I talked about them sending us information about all these different events that are going on, the more of those that we participate in, the more actual real world that we'll actually see and learn. And it's amazing how much you just new stuff you find out every one of these meetings. It's just amazing. So, but the goal of these two committees is to provide DHS additional support for solving problems that impede the delivery of the services that they have a passion to deliver. And so we are not suggesting that people aren't working hard, people aren't doing what they're supposed to do, but our role is to help. And instead of, we don't want to just be a bunch of rubber stamps here. We want to be involved, and there's a lot of expertise that, you know, that I guess some of us got just by number of years we've hung around, right? And so we want to participate, but we do not assume that we know everything. So I want to be sure everybody takes it from that position. And then, so that's the first goal. Second goal is to understand the real world issues and the thoughts of how those barriers. That's why I'm asking the questions from the key leaders. What's your biggest problem? And in my business life, I've always loved to solve problems. And so I've learned that if you can really get to what the problem is and clearly articulate the problem, and then understand who or not who isn't supporting the solution, that's how you really get to the end of the problem. So we just want to help overcome whatever. And in no ways it's suggesting y'all aren't doing what you're supposed to do, but it's just another approach. And maybe y'all tried 3 things and we've got another couple of things that might work. And so, so that's the second goal. And then really it's just to understand the specific processes of each area. I mean, I didn't know that we were helping on the response for the hurricane. I've never heard of that. I've been on this board for 9 years. 9 years. And so, I mean, gosh, I mean, my mind was just running crazy, just trying to think, you know, how to get more volunteers and all that. So, and it is, each committee will have their own meetings, whether they meet here or whether they do a meeting at their home or whatever. And so I just want to, and plus that'll help us bond more together as a board and really get to know each other for the, you know, good, bad, and ugly that we are. And so that would be the 3 goals of these committees. So I will leave it to the group. And if y'all could let us know if you can just talk in the next 30 days and decide who's going to lead it, and then just communicate with me on that. I think y'all all got my numbers. And so we'll just go from there. All right. Anybody else got anything or any questions about the committees? Okay, we're here to help, not to hurt. Okay, so.
I think you watched the movie Moneyball. What's the problem?
What's the problem?
Yeah, what's the
And
problem?
how can we assist? Yeah, okay, all right. All right, so, any other business that we need to handle?
Okay.
All right, so, at this point then, I guess I gotta do this again. We'll adjourn the meeting. Will be on January the 8th in our new facility. All right, so we look for, and you'll let us know where that is.
Yes.
What floor and where we're supposed to park and different things.
As always.
And I would just say thank y'all for the folks that came. For y'all that are on the phone, thank you for hanging in there with us. But I would hope that we get the more people that we can be here physically. I think the more it's possible. So I know that they say that it's possible to, you know, do Zoom or do these things. But if unless you've got a reason why you can't be, it'd be great if you could be here. So, and that's sort of where we've always been. All right. Thank you for your time, and great to meet everybody again. All right.